Okay, well, hello, everybody. Welcome to the Local Food for Food is Medicine Forum. This is brought to you by Food is Medicine Massachusetts Coalition, better known as FIMA. My name is Jessica O'Neill, and I'm the co-chair of FIMA's Community Benefits Organization Task Force, who has put together the forum for you today. So thanks for choosing to spend your time with us. We're really happy you're here. Just a bit of housekeeping to start. Please keep yourself on mute and use the chat to bring forward any questions that you have or comments that come up for you as you listen in to the discussion today. We'll be looking to the chat when we get to the Q&A section of the agenda. So keep those questions and comments flowing throughout the time that we have today. We've put together a wonderful panel for what we hope is going to be a robust roundtable discussion that illuminates both the challenges, but also the opportunities for getting more local food into food as medicine programs here in the Commonwealth. There's so much that we could dive into about local food and food as medicine, but suffice to say that the food as medicine movement here in Massachusetts is innovative, it's exciting, it offers up a really important opportunity to connect our local farm and food system with our healthcare system to promote health for farms and people and animals and our planet. And so our panelists today represent a broad geographic spread across Massachusetts, bringing you a unique perspective or unique perspectives from all along the food supply chain. So I'm going to quickly introduce the panelists and then welcome our moderator to kick things off. So help me welcome our panelists today: Henrietta Isaboke, Executive Director of World Farmers; Kate Menifee, Food Business Coordinator from the Western Mass Food Processing Center; Meryl Latronica, Director of Farm Operations at Just Roots; Nick Martinelli, founder of Marty's Local; Ted Katsarubis, CEO of Katsarubis Brothers Produce; and Andrew Gilmartin, Director of Business Development at Katsarubis; and Brian Hilmar, Executive Chef of Community Servings. And here to help us moderate the discussion today, I'd love to welcome my colleague and friend, Winton Pitcoff, Director of the Massachusetts Food Systems Collaborative. Winton, take it away.
Thanks, Jess, and good morning, everybody, or good afternoon, everybody. I'm Winton Pitcoff. I'm Director of the Massachusetts Food System Collaborative. The collaborative has been working for the last 6 years to try to facilitate implementation of the Massachusetts Local Food Action Plan, which was completed in 2015, and actually included recommendations that involved things like healthy food prescriptions, talked about needing hospitals and other institutions to purchase more local healthy food, and generally was trying to encourage more connections between the medical profession and the local food industry. And so it's exciting to see the work that is coming out of the food as medicine organizations. So the point of today's conversation is really to demystify local food sourcing for food as medicine programs, talk a little bit about what it actually means functionally, talk a little bit about why it's important, and hopefully make those of you who are listening in feel encouraged and emboldened to try to reach out and make these connections where you are. Food as medicine interventions are really just about when we tailor available foods to meet specific needs of people who have or are at risk of having serious health conditions affected by their diet. And you can learn more about this, the umbrella of Food as Medicine, at foodismedicinema.org for the Massachusetts Coalition's website. We're also going to talk a lot about local food today. The term local is a little bit of a lightning rod, and we're not going to try to pigeonhole our panelists into defining what that means. In some cases, it means just in Massachusetts, but some folks are right on the border with other states, and buying food from New York or Vermont is certainly within the realm of a lot of people's definition of local. So things may apply differently wherever you may be. But we're going to look at it somewhat broadly here. And along those lines, we know that there's folks on the listening in from other states. We're focused on Massachusetts, obviously, but we fully believe if this stuff can happen here, it can happen in other states as well. And so hopefully there's some things still from our model that are useful takeaways for you back at home. With that, I want to give our panelists a chance to introduce themselves before we get too deeply into the discussion. So I'll just call on folks, and if you could take a minute or two to introduce yourself and your organization and a little bit about your connection to food as medicine work. So I'm going to start with Henrietta.
Good afternoon, everybody. My name is Henrietta Isaboke, and I am the Executive Director of World Farmers. We are located in Lancaster, Massachusetts, and we support small-scale farmers with access to land and in making a sustainable agriculture business. And 100% of our farmers are immigrant and refugee farmers. This first season, we were able to support 354 farmers in about 80 acres of production in 5 different land sites in central Massachusetts. And our motto is really basically, our organization started way back in 1984 when a refugee farmers approached an immigrant farmer and asked for a piece of land off of where they were doing dairy business. And more farmers started coming to her. So they turned one of their farming land sites into what is our founding program site, which we call Floods Mentor Farm. And in 2010, it was incorporated into a nonprofit organization. And from there, we've just seen a lot of people really just coming to us. We don't spread the word. People normally find us. They want to produce, they want to plant food that they are used to. And we as an organization, we serve as the centerpiece. So all our farmers are small scale farmers. We are farmers that produce from 50 by 30 to farmers that produce over 4 acres, I'm sorry. And so we help these farmers do business planning, we help them find markets, and we assist them in just anything in between, from farming to production to having access to markets. We have a successful CSA program. We do wholesale to local supermarkets. We provide food for schools as well as restaurants. And I'm excited to be here and to see how this discussion is gonna go.
Thanks, Henrietta, and welcome. Nick, take a couple of minutes to introduce yourself, please.
Sure, thanks. Hi, everybody. I'm Nick Martinelli from Marty's Local. We are a food distributor based in Western Massachusetts in South Deerfield. We started in 2016, and we work with about 80 farms and food producers, primarily located throughout Western Massachusetts and New York and New England. And we're really specializing in local and regional foods. We're focused on source identification and high quality foods across produce, dairy, grains and flours, meats and eggs and cheeses. And our customers range across from colleges and schools and healthcare providers, restaurants, caterers, farm stores and retailers. And we are particularly interested in food as medicine as we look to work with more hospitals and really to prove that accessing the high quality foods that are available abundantly here in Western Massachusetts and New England are in fact accessible. And that's what we've been trying to prove over and over again over the last now 7 years, that they are accessible, and that we're providing that link to make it simple. And thanks for the opportunity to be here.
Thanks, Nick. Ted and Andrew, introduce yourselves, please.
Hi, guys. My name is Andrew Gilmartin. I'm the Director of Business Development with Katsarubis. I'm joined here with our fourth generation CEO, Ted Katsarubis. We're standing in our warehouse in the Hyde Park area of Boston. We operate out of about 100,000 square feet, servicing 6 states with 50 trucks. We might see our trucks at some of your favorite restaurants throughout New England, but the reality is that a big part of what we've always done is helping various local pantries, food shelters, veterans groups, various outreach centers that need the same quality of ingredients that chefs need for their clients and their service. For what we do for our restaurants, it's always been our core. We're sourcing from 6 to 8 growing regions throughout the country. But because this is our backyard, whenever everything becomes in season, everyone's banging on our door that they want access to local, and it doesn't matter if it's the chef or anyone else within our customer mix. Our job is connecting great producers and growers with end users. So if we can do that to provide healthy, nutritious items for people in need, we're here to help.
All right. And Ted, did you want to say hi?
Yeah, of course. So my name is Ted Katsarubis. Like Andrew said, it's a family business. We're over 100 years of being in a business as a family-run operation. I run it now with my sister, and it's for us. It really it's what runs through the soul of the company. It's really a privilege to be able to serve people in the way that we do, from wide range from healthcare to restaurants, but also with all the different programs that we work with for food insecurities and food access reach.
Thanks. Brian.
Good afternoon. I'm Brian Hilmer. I'm the executive chef at Community Servings. If you're not familiar, Community Servings is a medically tailored meals program located in Jamaica Plain in Mass. Essentially what that means is that we produce scratch-made meals to provide calories and nutrition for about 2,000 clients currently every single week. We cover their weekly needs. And each of their meal deliveries is specifically catered to what their nutritional priorities are, what their health priorities are. So a person suffering from renal disease or heart disease or AIDS and HIV or recovering from chemo or things like that, they need a very specific type of diet. And so all of our recipes are designed to provide for them specifically what they're looking for. My role in setting both the menu and recipes, but also selecting products and purchasing them, is always guided by the philosophy of do the most good possible. And knowing that we are supported by the community that we're in, we're also looking to utilize the resources that are entrusted to us responsibly to support the community that's around us. We also find that accessing local foods as much as possible shortens our supply chain. There's plenty of business cases to provide information or evidence as to why that's advantageous for us. But we're also looking at having an extremely high level of traceability and transparency to understand exactly where our product is coming from, as we need to understand perfectly what the nutritional contribution of each of our ingredients is that goes out to our clients. But very happy to be here and share this. I know local has been a word that's been thrown around the restaurant industry for decades, mostly as a marketing term, and I love to see it used as more as a real term, as not to try to gather interest, but actually to really solve a problem.
Great, thank you, Brian. Meryl, hi.
Good afternoon, everyone. Hi. I'm Meryl Latronica. I work at Just Roots in Greenfield, Massachusetts, and I like to talk about Just Roots as a nonprofit organization, a social justice organization, and a farm all wrapped into one, triple threat. Our mission is to create equitable access to healthy local food in Western Mass, but it's also to work for just, vibrant, and sustainable farm and food systems in our area, and also as far as we can see. So I'm really excited to be here today. My role at the organization is the director of farm operations, which essentially means I'm on the production side, growing food for our CSA market and donation outlets, and caring for the 61 acres of land that we lease from the town of Greenfield. So essentially my role in terms of the food is medicine work that we do, it's in production, but it's also in purchasing. We grow on about 7 acres of vegetables. We grow organically, non-certified. And in a wet year like last year, that kind of decreased to about 4.5 acres. And so serving for 400 CSA members weekly through the months of June through October, and about 300 members monthly through the months of November and May. That became really challenging to do when we entered into the food as medicine sphere and added 150 members to our roster. And that's when we really started purchasing in. So making that jump from 250 shares in a market and a donation to 400 really opened our eyes to like, all right, we need to bring in food. So we went from, in 2019, I think maybe purchasing in probably about $7,000 worth of food, to this past year in 2021, purchasing in $182,000 worth of produce and protein from local and regional sales. So really excited to be here. And yeah, we serve 150 members from farm to doorstep every month of the year, going on, this will be our 3rd year doing that. Excited to be here.
Thanks, Meryl. And Kate.
Hi, everybody. Thanks for having me. I'm Kate Menifee. I'm here representing the Western Mass Food Processing Center, which is a shared use kitchen and co-packer in Greenfield, Mass. The Food Processing Center is actually a program of the Franklin County Community Development Corporation, which is a nonprofit that has been around for 41 years now, furthering economic development in Western Mass and beyond. So we have a team here that provides one-on-one technical assistance, workshops, financing to all different types of businesses who are either starting, scaling, or growing in some way. And the Food Processing Center, which has actually been around since 2001, specifically serves specialty food businesses. So we help anyone who is trying to make a specialty food product and take it to market. And so that's all different kinds of things, sauces and beverages and toppings. During harvest season, it's lots of value-added products like pickles and salsas and apple butters, you name it. So we really serve as kind of, we have a rental space for folks who want to come in and make a product, but most of what we do now is co-packing or contract manufacturing. So really serving as that food processing part of the food system. We also have our own line of products called Valley Veggies, which many of you are familiar with. We started this about 7 years ago as sort of a small side business or a side hustle that we run. So we bring in produce from local farms, generally about 25 miles from our facility, process it generally within 24 hours of harvest, and then flash freeze it and pack it in bulk packs for institutional buyers like K-12 schools, hospitals, colleges. And then we also just this past year started packing it in smaller 12-ounce retail packs for retailers like grocery stores and some of our CSA partners like Just Roots. So that is just another aspect of the food system. We kind of represent a couple of different spaces within the system. So we're a buyer of local produce. We're a seller of lightly processed product, but really most importantly, we are a processor and a co-packer for farms and other specialty food businesses. So thanks for having me.
All right, thanks, Kate. So we've really got just about every link in the food chain represented here on this panel, which means we're going to be able to solve everything in the next hour and a quarter or so. I think everyone on the panel already agrees that the idea of connecting local purchasing to food as medicine interventions is a good thing. And maybe even most of the participants that are listening. But I don't want to make it so simple as to just stipulate that it's a good thing. I think that we all have to convince other players that we work with. And so I want to start out with talking about why is this important. And Brian, you started to get into this in your introduction, but I wanted to give you a minute to dig in a little bit more as that sort of final link in the chain. What makes it worthwhile to community servings to be sourcing local food, and what would make it worthwhile for other organizations like yours?
Thanks, Winston. So we're in a kind of a unique position in that we need to control all of the sort of nutritional contents of everything that we're serving to our clients. And by connecting directly with a producer, we're able to either control exactly what it is that we're getting from them, or at least at the very least understand exactly what it is that's coming out of it, with fewer links in the chain, which means that there's fewer disruptions in that supply chain. So this pandemic served as a fantastic example of why a short supply chain is beneficial. While some of my peers in other elements or other parts of the industry were struggling to get products that were coming out of the Midwest or the West Coast, or abroad. So all of our fish comes out of local waters from local independent fishermen. We never had any service interruption. We never had any price changing on it. It was just a continuous flow of like extremely high quality product. All of our beef is coming out of Vermont directly from, again, independent cattle farmers. And so they are able to consistently provide for us what we're looking for. So on top of the fact that it's an exceptional product, it's also exceptionally consistent. It's funny, like we have our tofu guy works up the street from us. So like the supply chain is literally 3 blocks. Like there's all of these advantages to being that close to the people that are producing the food for you. In addition to that, anytime that you want to work with a vendor in a positive way, you want to establish that relationship where you're looking to make sure that it works not just for you, but also for that vendor. Finding that sort of equilibrium or that harmony within those relationships is really what is going to enable you to be successful as sort of a collaborative effort. And so, like I said earlier, the food system is a closed loop. If you're getting cheaper product because you're getting it from somewhere else, like you're paying for that in some other way. Either there's additional transportation or packaging or energy that's used in order to get that product to you, or it's you're causing exploitative labor practices somewhere else in the country. Just because it's out of your direct line of sight doesn't mean that there aren't hidden costs elsewhere in that supply chain. So if we're able to see exactly what's happening and able to see exactly what the product is and contribute to people in our community who in turn are contributing to us, it's that high tide raises all ships. So that's not to say that we're just spending frivolously. We have to be good stewards of the resources that are entrusted to us by our donors, by the state, by the federal government, by our contract partners. And so we're not just this is not a charity case. This is there's tremendous reasons why we want to continue to put this money back into the system as it cycles back through to us. One of my favorite examples is the beef that I get out of Vermont is so clean and it's so beautifully raised that when you go through the cooking process on it, the actual loss that you experience from trim or from cookout is less than what you're going to get from a commodity product. So on the whole, it ends up actually being less expensive because of what the yield is, because the product is a much higher quality. So if you're spending the time to really analyze what the products are and how they're working within your system and how you can maybe adjust your system or your technique in order to really take advantage of that product or work with that product, you're going to find that there's benefits just beyond feeling good about yourself. It's also going to be economically beneficial to whatever agency you're in, whoever the group that you're working with is, and ultimately our highest priority is to make sure that this is beneficial to our clients. So we want to make sure that we're not just sending them whatever cheap empty calories we can. It needs to be a memorable culinary experience. These are people that are already suffering from an unfortunate illness, things that are not their fault. They don't need to be condemned to culinary austerity as well. So there's we kind of take this holistic view. It's about what is the most just thing to do, and it's supporting the people who need us both at the end of the line and at the beginning of the line, and how are we being good community members. And we've shown year over year over year that that's also exceedingly financially viable.
And Nick, as that sort of connection in between the front of the line and the end of the line that Brian was talking about, what messages do you find are particularly effective if you're talking to buyers when you talk to them about why they should be thinking about local products?
Thanks. Yeah, I think Brian hit on, spoke to a lot of the points, and really most of them, really articulately. And the only pieces that I would add that relate to our role have to do with our knowing the farmers and farms and food business owners that we work with in a really different way than a broadliner might in terms of the foods that they're able to offer. The quality of the foods that the partners that we work with are able to offer because of their growing practices, their wash and pack practices, the teams that they manage, the scale that they're operating at. The food really is of a different kind of it's a different product, as Brian's noting, than what you might get on the commodity market. And then knowing the producer, knowing the grower, knowing their practices, we take a real pride in and we think it's important that we have strong relationships with our vendor partners, whether it's a farm growing produce or somebody making a value added product. And that then when our customers are bringing that out to their, whether it's a grocery store or a college chef at a restaurant or a chef in a kitchen at a school or college, they have that trust that the sourcing has integrity, and that's an important part for us. Certainly, the flavor is there because it's fresher. The nutrition is different because it hasn't traveled across the country, or it's been harvested to order. It was harvested yesterday. So all of those components, I think, are relevant also, and just kind of fine tune or add to what Brian's comments there.
So if we can try to paint a picture of what it is that we're actually talking about here, I want to try to understand what these transactions actually look like, and with a question of, are they really all that different from transactions between a non-local buyer and a non-local producer and a non-medical buyer? And so, Merrill, you both grow and sell food, and you also talked about how you're buying food now. So can you compare and contrast the kinds of transactions for food as medicine versus to regular consumers?
I can try to. It's really fun being kind of growing from a grower into both a produce buyer and protein buyer, I will say. So I guess just to back up against, we do our CSA. So we have a 400-person CSA with 250 of which being a home CSA. So within Franklin County, people that are coming to the farm, a little more of your sort of, come to the farm, go shopping with what's available for the week, build your share, take it home, or get delivered if you need. And then the 150 shares that we do for Food is Medicine, that's through our Boston Children's Hospital ACO partnership. So those families that we're serving, they're coming to us through the pediatric patients that are struggling with food insecurity. So that's kind of how we connect with those folks. And those shares are being boxed up and delivered to doorsteps. So different from our normal CSA, there's less choice involved with those boxes. So I'm doing more of the really putting together of that share. And the way that we work is, we do our own walk about the farm, see what we have growing, see what we can provide for these shares. And then we're finding, each week we're ranging from, well, we needed one additional item to round out these boxes, or, oh, we might need 4 or 5 additional items because we lost that to flooding, or that didn't come through, or our CSA members ended up taking a lot of peppers last week, and so we're a little short. So we do a lot of just creatively building the shares each week. Once we find out how much we need, then we're looking to our go-tos, and our major go-to is right here in the room, Marty's Produce. We've connected with them last year, or maybe the year before, started working with them. And what's amazing about working with Marty's is I can look for kind of parse out like what's organic and local, what is local but maybe IPM or conventional, and then what is organic and maybe further afield. And so we have some options that we can sort of filter our choices with. So we always go first to that, what is organic local. We're super lucky to be located in Franklin County in the Pioneer Valley. And so finding, looking out from our farm bubble, once we needed to buy produce in, it was like, holy moly, there are so many farms, there's such resources here. And that's, I have to say, just like a really special part of where we are particularly. So how that serves us is a couple ways. One is Marty's is able to aggregate a ton from the local area, but also go into Boston and further afield when we need to. But we're also able to have our relationships that we're building with individual farms. So we end up doing basically a hybrid. So we have our distributor, which is Marty's, which is our sort of one-stop shop where we can go to and find a bunch of stuff. And we especially go to those folks when we need a lot for the week. So when we're buying in a lot of different products, and where that might take me to like several different farms to do the aggregation ourselves, we know that we can trust that Marty's is doing that work for us. But then if we have a week where we need like 1 or 2 items, we can call the farms that are in our neighborhood that we trust, that we have relationships with. And that part is really fun because when I get to work with farms individually, I get to sort of do a little bit of what Marty's is doing. I get to have the relationships with farmers. I get to build my community of farms. I get to go and pick up produce and check out farms and talk shop. And I can sort of also have a relationship that's a little more like on the go. I can call them the day before, like, oh, hey, I was going to get some beans, but actually don't need beans. What else do you have? So it's a little more sort of casual, and we're building a relationship. It's just like we have with our CSA members, just on the flip side, where I'm buying in stuff. We're talking about their growing practices. There's a lot of transparency and chatting about what's available. And what's nice about that as a unfortunate procrastinator is I can sort of make those orders the day before if I have to. When I'm working with Marty's, obviously they need some lead time to make sure that happens. It's not a lot. They're very generous with procrastinators like me, but definitely it's like a little bit knowing my stuff ahead of time, making sure I'm getting things in so that they can talk to their growers. So that hybrid model is amazing. And each year I sort of evaluate, like, should I get every single thing from Marty's? They do it well, they deliver. That's awesome. Less time off the farm is good for me because I'm still in a grower role and a leadership role. So I'm not totally just focused on buying and sourcing. But at the other side of the coin is getting to go see farms and becoming, really interconnected. So yeah, I mean, I think relationship building, directly giving our dollars to farms without the middleman is awesome. Can be more flexible and it's really fun. But buying in from like one farm at a time, it does require us to go get produce, get off the farm, take that delivery piece on, which that's one of the major reasons that we love Marty's is they're coming to the farm and they have multiple deliveries a week. And it's just like, yeah, so having a hybrid really works for us. And we also, I think one of the things that is really fun about working with just individual growers is that we can serve to sort of say, like, what are you up to this year? Like, what do you want to do for your meat production? And this especially happens with us with meat production, chicken production. We have like one beef grower just in the next town over. So they're really growing their animals to serve our needs and vice versa. And they know that they have a guaranteed place that they can sell their product. And some of our chicken growers are new chicken operations. And so they're saying like, well, I want to get into this. And I can say to them like, well, I can guarantee that I need at least 150 birds every month for our meat shares that we do. So, here's a guaranteed market for you. And I think we've been able to do what our CSA customers have done for us, which is say like, we're going to put a little money up front into your business. And in return, like you'll guarantee us that product, which we know is going to serve our clients. So it's been really fun.
And just a quick reminder to attendees that there's a Q&A function that if you've got questions for panelists, you should feel free to post the questions there. We may not get to them in the middle of the discussion, but we'll certainly get to them towards the end. Andrew, from the other side of the transaction equation, would like to hear your perspective on what transactions look like for the food as medicine through line, and if they're really all that different from your other customers.
In a way, they're a lot easier. For us, working both with local customers and local farms really helps connect the dots. Us as a facility, our warehouse, we're SQF certified, which is part of the Global Food Safety Initiative. So it's a certification in food safety, making sure that, Nick kind of touched on this and what he was saying, that there's good agricultural practices being practiced by the farm, everything from how things are being washed and processed to bagged to transported. So we do all that legwork on the front end to make sure that you as the end customer are getting product that's wholesome and safe, and on top of that, that it's local and delicious, because when you're cutting out the transportation between West Coast and the East Coast, you're typically getting product that is superior flavor, quality, and yield. So having kind of all the decision makers within a couple hours of each other, it's easy for us to Chef Brian's a good partner of ours, that if he calls me, he's like, Andrew, I need this product. We can actually act as an aggregator in some senses, because some farms grow, a lot of one or two types of crops, and it's easy to get large quantities. Other crops, depending on the time of year, what's going on, look out the window, it's pouring rain and there's issues. Brian might not be able to get everything he needs from one specific farm, but because we're buying from, 20 local farms, I might be able to get the total need that he needs. But he also has, the understanding that, we've done all that legwork on the food safety side, and we can get, the local, safe product to there. And it just ultimately is a lot easier than, some of, the other programs we've done with other customers who need product from all over the country, and there's 20 decision makers in 3 different time zones. It makes things, a lot harder and needlessly long. Having everyone on the same page, looking out your window and seeing what the weather's doing and what crops are available, everyone wins in that scenario.
And Henrietta, you work with a lot of farmers, and I know that with some of them, you actively work to try to help them get access to markets like what we're talking about here. And so I'm curious, where do you find they struggle the most, and what help do they need the most in accessing distributors and the other market channels to get through to the food as medicine buyers?
So for us, I want to say we are a little bit unique, because we also do serve as the aggregator for our farmers. So having such small scale farmers, they wouldn't get the opportunity to be part of the food is medicine because of the demand of produce that will be going out. So having the opportunity to tell our farmers, don't worry about what you're growing, we have a market for it. So in a sense, having them have the security that their product will be moving gives them a little bit more time to focus on, okay, I'm going to focus on if it's just kale this year, and I'm going to do the best kale that I'm going to do because I have a ready market for it. Becomes better for them rather than growing on a smaller scale than they're already growing and focusing more time in finding the markets for their products. So we find that having that relationship, we are both like supporting the farmers in growing. We go through the safety trainings. We teach them what the good agriculture practices are. And then in the end, having, aggregate and bringing these products out to the food is medicine participants gives us that extra pride. It's like, okay, I know exactly where it came from, how it was packed, and now I know exactly where it's going.
Kate, what about from your vantage point? What do you see as sort of stumbling blocks? What would make these kinds of transactions easier for the people that you work with?
Yeah. Well, first of all, everybody's just like speaking my language. I feel like I should be like snapping my fingers over here. So I love it. And what I hear everyone really saying, and I just want to reiterate, is that the nature of the relationship between a buyer and a local producer is just closer. We're a lot closer. We communicate a lot more frequently. We can do things on the fly, and that feels really good. As a producer, we actually look to our buyers to have some influence and some input as to what it is we're doing. So if people buying from us have input on our packaging or our product, or they want to see something different, we have that open line of communication. So that's something we would kind of welcome as a producer of a value-added product. So that's one piece. And you asked about kind of what would make the transaction easier. I think what I always come back to is like production planning. I heard Meryl talking a little bit about that, and other folks. I think that because we have a close relationship with our buyers, we generally do some production planning. I would like to do more of it whenever possible. As a small producer, it's great to have a sense of like what we're going to be expecting from our buyers over the year, especially for us as sort of an interesting entity. You know, we're doing co-packing for some specialty food businesses. We're working with farms. We're producing this line of flash frozen produce. So building our production plan for the season can be really challenging, as I'm sure it is for all different kinds of producers. So the one thing that makes everything easier is having even a rough production plan from our buyers, you know, being able to reach out to Nick at Marty's and just ask, like, what do you think you guys are going to be looking for this season? We do the same thing with Just Roots. And so, yeah, just again, having that open line of communication about what to expect. And then just knowing that our buyers and us have that relationship that's open, that's flexible, and knowing they're going to be able to kind of be nimble and adapt if it rains too much like it did last year. So that's what comes to mind for me.
Got it. Thank you. Others, I want to open this up to everybody. Do others of you have thoughts about what would make these kinds of transactions easier? I know you all are moving food every day and don't have time to necessarily sit back and think, I'd like to blow up this, or maybe you do. I'd like to blow up this system and rebuild it. And how might it look a little bit differently or a lot differently if you wanted to change the way these transactions happen?
I'll jump in on that. You know, for us, you know, I would say advanced planning. You know, a lot of times you have people looking to create a menu or, you know, a specific dish or kind of segment, and they don't do the research ahead of time of what's actually in season, what's ready, or what it takes to move 5,000 pounds, whatever the example might be. You know, so from our side, you know, we have 50 trucks going all over New England. You know, I can get pretty much any product with a little bit of notice, but when you have people that are calling the night before, you know, we do what we can, but, you know, we like to take the approach of having, you know, couple, 15-minute conversations a week with each customer of just, what are you planning? What are you thinking about? What can we help with? Because ultimately that's going to make it easier for the farmer who's going to have to pack the product, us that has to move the product and get it to you, and for you to have what you need without stress.
Yeah, and I'll add to that. I agree with Andrew. I think that planning, if we took it one step further back and said for this whole season to, let's say, a college, how many pounds of potatoes are you going to go through over the course of the year, or to a hospital? I think there, in some cases, is a perception that the farms are too small to be able to support that volume. But in reality, that's not the case at all, particularly with potatoes, but here in Western Massachusetts. But with many of the crops, if an institution said at the outset of the year or just before the season, here are the, or several months ahead of the season, here are the quantities that we need throughout the year, that really helps us work with our farm partners to have that certainty for them that product's going to move. And of course, there's the weather, challenges that arise, and we work in contingencies for that. But for those chefs who have experienced that, they realize that it is a great way to supplant their commodity purchasing with local purchasing, and they see the difference throughout the cycle.
So the shift needed really is to change human nature and stop everyone from procrastinating.
That's right.
So I'm not sure that's so much an investment or a policy change, but Meryl, you were jumping in on something.
I was just going to say, I love that, Nick, because I feel like, I haven't gotten in the habit of doing that with vegetables. We definitely do that with meat because we have to talk to our livestock growers a year ahead of time for slaughter dates and making sure that they've bought in enough of, baby chicks, et cetera. But I think it's funny because we have our crop plan and we have a line of like, we think we're going to buy in this much, but I never call you and tell you that. So it's like a good thing to listen to of like, oh yeah, we already kind of know what we're going to need to buy in this year, but it's, I never really, it's more like for me to be like ready to call as opposed to like giving you guys the heads up. Or this year, one of the things that we're trying is working with a or I would say in general, one of the things we love to do is support beginning and new farmers. And one of the things we're trying to do with our buy-ins is connect more seasonally with new growers, to say, like, not just for meat growers, but for veg growers as well, of like, hey, can you grow me, like, send me 2 things a week of this, like out of this list of produce, like, so that I don't even have to think about buying in like some of that stuff, but I'm sort of pre-scheduling that with another grower, which is something we're going to try out this year. But it's a similar sort of kind of knowing ahead of time that we've got some growers that are thinking about Just Roots every week and getting us like some amount of produce, and it can sort of be whatever works for them. We can work around that because we're also a grower, so we can sort of supplement accordingly. And so I'll let you know next year how that works, but I'm excited to try it.
Brian, from your perspective, are there things that would make the transaction process run more smoothly?
So for us, we are pretty dependent on aggregators and distributors. Like, we do not have the resources, logistical support to go and access, go farm to farm and access the products that we're looking for. So the more I would say that local buyers are connecting and being and utilizing the existing supply chain, the easier it is for for agencies like mine, where we consume just massive amounts of product all the time. And it is very predictable what we go through, but for us, that's really kind of the key factor is getting the product to us. One of the one of the sort of comparisons that I think of is like when the craft beer market exploded. It didn't explode because everyone was really excited about craft beer as much as it was that AB Bev started allowing those smaller producers access to their supply chain, and they were able to distribute all of that product everywhere. And so it really revitalized the beer industry. And it would be interesting to see how kind of a replication of that process happening, at least maybe on more of a local side, of getting these larger distributors to really be focusing as much as possible on accessing local and really prioritizing that. So,
and I think, Winton, to add to that, of course, price point is a stumbling block that people think about, and I think there is some reality to that, and there's also some perception that's inaccurate, particularly when that planning is there, because at that volume, the price can often come closer, and as Brian described, in terms of the actual yield, in some cases it might make it a better or greater value to purchase locally. And certainly if you take in the externalities, the other costs, that would be a great analysis to see the real numbers on the costs of what we're shipping from 6 minutes down the road to what's coming from across the country. And I say that knowing that we also bring in food from across the country too. So it is it's a very practical consideration that every business has to make, whether it's a hospital or a college or a grocery store. But I think in many cases we might be surprised by the outcomes.
Thanks for bringing that up. I think cost has been conspicuously absent from this conversation so far. And it's actually the next question I wanted to ask Henrietta was, in working with farmers to price products, there's the price that it actually costs to produce something, and then there's the price you have to charge to be competitive in the market, and then there's a range of prices there. And to some extent, wholesalers are you're competing with big industrial food companies that are selling certainly not the same products, but similar enough products for some buyers. I'm curious how you help your farmers set prices, and as part of that equation, is there a philosophical discussion about why you actually want to sell into this market? Why do you want to be prioritizing selling to food as medicine operations?
Well, I will start with why this marketplace. Having 354 farmers, for example, each growing about a few plots of kale, they're not going to be able to compete with somebody that's buying from 50 acres of kale. But just considering what it takes for production. You know, these are small scale farmers, meaning they're putting more labor into their work, and they don't have the infrastructure, or they don't have access to growing larger quantities of food. So we have to take into consideration what practices are they using. Most of the 100% of the farmers we support use good quality, good agriculture practices. We do organic farming, not certified, but nonetheless, it's organic. So in considering the price, we really just look at what is the organic price for the produce that we are growing. And that helps us set the market value, because we can never really put the value of the products they are growing, because a lot of our farmers are using their hands. It's manual labor. We don't have a lot of farmers that have any tractors that they're using for either planting or weeding. It's all manual labor. So we can't really put the price of what the products are, but we can come as close to by following the market model and saying, okay, our produce is more organic, and we cannot chase the money or reduce the value of our product just to get into the market, but rather it's just taking the quality of our food and saying the fair price for this food is set at this level. And then now it's up to us to kind of find who's willing to buy our produce at what we have set as the market standard, and not letting us or not asking us to reduce our prices because they think they could get the same product from somebody else. And so getting the chance to be in the Food is Medicine program kind of gives us kind of breathing room. It's like, okay, we can afford the farmers that we support a fair price for their locally grown produce without having to compete with other people. And going back to this past season, our farm was flooded, about 98% flooded. So produce wasn't there, which forced us to start sourcing from other local farmers. And as we are looking into these local farmers, then we kind of we know what the farmers are going through, because we are going through the same thing. And we were able to give the farmers a fair market value for their produce.
Thanks, Henrietta. So you all have made this sound really positive so far. And I want to try to dig in on where some of the challenges are. And Kate, wanted to start with you. What makes it hard? And I know moving food, selling food, growing food is hard, period. But I know that there are also particular challenges that come with any type of transaction or any type of market. Are there things about this that makes it particularly challenging?
Yeah, I could go on about the challenges. I'll talk about a few of them. I think supply in general can be hard. So we're, bringing in raw produce and lightly processing it, freezing it. And, we don't get to work with just one producer of broccoli or one producer of carrots. We're working with a number of different producers. So that's just increased time kind of communicating with those people and making a plan, which isn't to say that it's impossible, but sometimes it stretches our capacity. So that's an issue. And, working with small farms, sometimes their supply itself is limited. So we might be hoping to bring in 40,000 pounds of broccoli in the fall, and we end up with 10 or 20,000 pounds. And then we kind of have to pivot, or we have to explain to our buyers that, we're not going to be able to meet that demand. And then they in turn have to make another plan. So again, it comes back to flexibility on being able to be nimble. That's one challenge. The biggest thing that we struggle with, I think, as a producer is our own capacity to do sales. We're a nonprofit organization, but I think I want to say that this is probably relevant to any kind of small producer of food. Our capacity to do sales is it's limited. It is, we have to go out and find buyers. We want to provide excellent customer service. We want to have good follow-up. we want to be documenting any problems that arise and kind of troubleshooting those and making a plan to fix them. But just generally the capacity to kind of manage all of that is really challenging for us as a small producer. I would say that's the biggest one. And to put my positive spin on it, I would say we really lean into our distribution partners to kind of like help supplement that capacity. So like I said, we work with Marty's and we kind of lean on them to like help supplement that sales capacity for sure. So they're helping us to navigate buyer relationships and deal with issues or deal with questions or new interests. As are some of our other distribution partners. We work with Food Connects in Brattleboro and Farm Fresh Rhode Island, and they just like add a lot of capacity. And then the other sort of thing that we've done to aid that lack of capacity is we've partnered up with a group called the Northeast Food Collective. This is a group of food processors that includes our food processing center, Commonwealth Kitchen in Dorchester, and the Vermont Venture Center, who makes a fresh cut produce, a fresh cut product. So we all meet regularly to talk about challenges, come up with solutions, and try to like scale as a group to meet specifically institutional demand for local food products. That group has added a lot of sales capacity for us. It's facilitated by Healthcare Without Harm, whose mission it is for this project specifically to get more local food into the institutional buying network. So yeah, sales capacity is the challenge, and the solution has been leaning on our partners to help us do it.
Others' thoughts on particular challenges or obstacles in this particular supply chain?
I would say one of the challenges of getting into the Food is Medicine program, for example, is small farmers are not able to handle, let's say, for example, our organization would not be even part of this discussion had it not been for Just Roots reaching out to us. And having a trusted partner that is ultimately handling all the administrative tasks and ushering, small organization like ours through the process and being completely transparent through the whole process. This is what's going here. This is the negotiations that we are done, and offering us to be part of the program while dealing with all the things that we are not able to. So essentially we are coming just as a supplier, but we are still part of the team, like the ACO partners. We don't have the software to maintain the client list and adhere to HIPAA regulations, for example. But because they have taken on that overhead of handling all that comes with HIPAA, we are able to get into the program, and we are supplying, but we are also being ushered into step by step. This is what it will take to run a program like this successfully. So I would say not being able to, not even being at the table takes you off the market, but being small that you cannot handle a lot of the regulations that come with a program like this also takes you off the market. But having just people like Jessica and Just Roots in the whole program being, okay, we have this great model. We know you are able to produce, we know your growers, and we know that you can be able to assist and expand on this program is really important to us. Just wanted to highlight that.
So we've established that, you all with your mission-driven businesses or organizations are all deeply committed to this work. And you're trying to sell into a market that sometimes is and sometimes maybe is less so. And that they're looking for food, period. And we've all interacted with, been part of the transactions, or at least seen, that a larger buyer, a hospital or an institution, wants to proudly say they sell local food. And it means they've got some local lettuce one day a month or something like that. And how do you avoid that? How do you actually work with the buyers and get them interested enough so that being part of this is not just window dressing or greenwashing? And I wanted to pose that to Meryl first.
Thanks for that. I'm realizing that I'm not actually sure how our like how the ACO that we work with like talks about our work. So I might pose that back to Jessica if she wants to jump in maybe now or at the end. But I think it's a really, it's interesting to think about just the way we talk about our partnerships and who's selling to us or who's wanting to be partnering with us to say, hey, we're getting our product to this food insecure population. And like, is that, it definitely is interesting because I don't think right now we're doing a great job of storytelling all the different people that we buy from, nor do I actually think people yet are like sort of talking up that they're working with our program. But I will say it definitely has made our selling to Just Roots, I think, desirable for some of our partners because they may be a for-profit business, but would like to maybe have a stronger mission as part of their work, but are trying to meet the bottom line. And so when I can talk to them about like, hey, our product is going to this food as medicine work, it's serving families who are struggling with food insecurity, it makes like selling to us, I think, a more interesting endeavor. And I think does serve the buyers, the produce suppliers that we are serving. So I think there is something there that I have just really heard from some of our growers, especially a lot of our meat suppliers, that they're like really excited about getting their super top quality product into the homes of families that like would not be able to otherwise like purchase at the price points that these would show up at, the grocery store. So I think there's a benefit there, but yeah, I actually am now I'm interested. How does Boston Children's Hospital talk about Just Roots, Jessica?
Thanks, Meryl. Yeah, I mean, I think what I've asked them when I've said like, why work with us? We know our program is more expensive than some of the other options you have in food as medicine, like a grocery store gift card, much, an easier, simpler food as medicine solution would be a grocery store gift card than a year-round CSA with produce and protein from local farms. But what they tell us is they understand the benefit that local brings to all the points that many of us have made. Brian kicked it off of having a shorter supply chain and the benefit that has. So they're cognizant of the fact that their decisions have a broader impact on the local community and the health of the local community. So that's part of how they make their decision, and that they understand that the quality of what we can offer them is potentially more nutrient dense for their clients, and that we can offer in a CSA a family-friendly food as medicine option, which is just distinct from something like a medically tailored meal. We need both of those options on the menu. But so that's where I think a connection with Just Roots is a unique for them on their menu of food as medicine options. And the other thing I was going to bring up was also tying back to what Brian said about the micro, I think it was Brian, about the microbrews and their opportunity to like come into the market. And I think to what Henrietta said, there's organizations like Just Roots who are already in food as medicine that can offer up the sort of the opportunity for other farms to play a role in food as medicine without having to do all of it themselves. And so I think I would look and actually pose this to other organizations that might be like Just Roots that are already connected in and working in food as medicine to consider the role they can play in welcoming in more connections for local food producers. Thanks.
Thanks, Jess. We contractually obligated to talk about COVID since it's been so present in all of our lives and our businesses, and wondering, we've seen so much about how the not COVID itself directly as much as the labor challenges that COVID has brought on has really upended the food supply chain. Wondering how that has affected your work, particularly the work related to food as medicine, obviously. Brian, I wanted to start with you.
Yeah, sure. I just wanted to follow up on that last comment right before we jump into this. And I guess I would caution against this sort of purity test against the greenwashing versus, what's the true meaning of like a person who is using local food. I think that if more we can normalize that and make it part of just a regular supply chain as opposed to being like the marketing end of like the supply chain, I think that the greater the benefit that it becomes. So like the more like just the more regulated, or like the regular access to it through normal distribution change, I think is really potentially beneficial without requiring the sort of like purity test on, oh, are they truly local? How local are they? Is it 100 feet from their doorstep? Is that local enough? But I would say on your question about COVID, the benefits for us, our sister agencies and my friends in the industry were talking about like the challenges that they had, getting supplies in, stuff coming from DOT in the center of the country or coming from abroad that they're normally used to purchasing, because the cost of that was so low, were things that we really didn't experience nearly at the same level. And a lot of it was because we had that short supply chain, but it was also because we had those like personal relationships, those very strong vendor partnerships with our producers, and so they understood what was going on. And a lot of them are served restaurants as well. And so when the restaurant industry sort of shut its doors for several months, they were looking for outlets, and we were there ready to continue our business with them and find ways to support them and make sure that they were continuing to be able to operate while they went. So it was really about how flexible and agile is your production system. What are you thinking about, this week, next week, and the following week, to sort of predict what your challenges are going to be and how you're going to address them and who you're going to work with. It was just a matter of people having to think differently through this whole process, and not ironically, but serendipitously, I guess, there were improvements to the supply chain systems that we engaged with that were a result of having to be so agile and having to pivot like in the moment to figure out how to work better. So there was quite a bit of efficiency that came out of the crisis and understanding how to work in such an unforgiving environment. But really, it was the relationships that we had established with our vendor partners, over the last several years and beyond, that really helped us see it through as they were out looking and going to bat for us. I would also say that there really are just they're kind of two distinct, and Andrew can probably certainly talk about this more expertly than I can, but there's two supply chains. There's the commercial supply chain, there's a retail supply chain. And initially the commercial supply chain really didn't experience a lot of shortages because the commercial consumers were shutting their doors, whereas grocery stores and retail were really consuming at a much higher rate. Within the last like 9 months or so, we saw that kind of reverse. And when restaurants started opening back up and kids camps and colleges started seeing students again, you saw that commercial supply chain really get taxed heavily. And then that was when we really started to experience some challenges. But it was it was targeted, it was categorized within specific areas. It wasn't just wholesale across everything. And so by managing a constellation of, a dozen and a half vendors that have a fair amount of redundancy, we were able to get through without really any supply interruptions for our clients. So we felt the stress, but our clients never felt the stress. But, for the third time in this answer, it was really those relationships that saw us through.
Nick, similar experience on your end?
Yes, the short supply chain being durable was really what we saw. Our farm partners were, there was no hiccups because everybody was, the challenges that our farm partners have had that we've had too, and I'm sure everybody on the call has had, it has to do with staffing, and people incredibly really kept coming through in terms of production. Regardless of that, and we were fortunate to be able to do that too with our team. And so as Brian was commenting, as the retail sales or sector became the only sector in a way, and our farm partners were able to supply that or fulfill those orders and consistently right through. So as those customers were ordering items that were from local and regional partners, they were getting them, and we felt really fortunate to be in the spot that we're in as a result of that.
Kate, how about from the small business end?
Yeah, I think the biggest thing that comes to mind for me, the biggest thing we have felt during COVID, as many of you have, I'm sure, is just challenges with labor. Having enough people to come into the kitchen and process veggies and make specialty food products. It's been a challenge and an opportunity. So we've kind of had to hunker down, scale back the volumes at which we were producing. So we were on this great trajectory with our frozen veggies business. We were growing it. We were planning to scale and run higher volumes at a time to try and bring our costs down, which are pretty high. So that was the plan. And then COVID hit. The whole crew is, showing up to the kitchen, masked, working in close quarters. It's challenging. And we have a small crew of 7 people. Typically we bring on temp labor to help, but really like all the labor resources have kind of dried up. And again, like I'm sure many of you are feeling this pressure. So yeah, the labor to process was hard for us. We had to kind of scale back and go back to producing kind of low volume and keep our prices stable. So that was a real challenge and hasn't allowed us to grow at all. But I hope that we'll come out of that in the coming year. On the flip side, I think the fact that food service operations were short on labor was kind of an opportunity for us because we make a lightly processed, like ready to cook product. That looked, I think, more attractive to a lot of buyers than like a whole butternut squash or a whole bell pepper that they would need labor to process and break down and prepare to cook. So labor has been just a big boon this year. And yeah, I think that's the biggest thing. The other thing, I guess, that an opportunity that COVID has presented for local food, I think, is these new home delivery services that are popping up. That's been an opportunity for us and I think a lot of other producers. So out in Western Mass, we have the Sunderland Farm Collaborative, which was started by Kitchen Garden Farm. We have Mass Food Delivery based out of South Deerfield. So these are, home delivery of local food products. So that's been like just a really great distribution avenue for our products and many of the producers working with us too. And I think that was really something that was spurred along because of COVID.
I want to start moving towards some of the questions from the audience, but first wanted to ask any other panelists have anything they want to add about the last couple of years and what that's meant?
I actually have one more thing to say. I made a note and then forgot to come back to it. I did want to just put it out there that I think infrastructure for processing and storing and moving food is always a challenge. Specifically thinking about storage of frozen products. So we think about local meats, our products, we need freezer storage for those things. And I think the state really came through with the food security infrastructure grants that came out last year or the year prior. So that's been an opportunity for a lot of the producers that we're working with. And I appreciate that the state kind of recognized that as a need. And I think it's been a real opportunity for a lot of producers to expand what they've been able to do with that money.
Meryl.
I guess the one thing I'll say just about the last 2 years for Just Roots is that really working with within Food is Medicine, it really changed our operation. Like it really gave us the kind of resources that we could then turn from that $7,000 a year buy-in to almost, budgeted over $200,000 this year if all goes well. So I feel like that piece of our mission to not just support folks with our food, but to be able to give to the local food infrastructure and local food economy has been such a expanded part of our mission that and to live in an area where and in a state where it's easily accessible has been really a game changer for our organization.
Henrietta.
For me, I want to say it's an opportunity that people, the immigrant and refugee farmers we serve, really see the impact they have on the mass food system. I mean, with the food box, we were able to provide about 1,500 boxes per week. So they saw the importance of, making plans for their products and really how agriculture could be something sustainable within Massachusetts. And they really get rewarded by just, telling them this is how much impact you've had on the food system. This is how many people you guys have been able to feed. And it brings a fire in people, and being able to be part of the Food is Medicine now, we can be like, for the next couple of years, you have a guaranteed market. So just grow, and we'll see where it goes. So it's just great to see people excited about local food and being part of the food system.
I want to, so the first question from the audience is definitely for Meryl and for Henrietta. Have any of you found a way to offset the cost of local produce for low-income individuals? And note that this is from Georgia, so they may not be aware of things like the HIP program or the work that Just Roots has done with others in the medical industry. So Meryl?
Yeah, I mean, I think that here in Massachusetts, having HIP really has been an incredible resource. And I think it's, but I think one of the things for us, and maybe I'm speaking for myself, but Jessica can jump in, but I think that we really we try to talk about the value of produce and that like, we don't believe in the cost of produce being, rock bottom. And I think that we try to talk to our members about like why the cost of the share is what it is, and the subsidies that are provided by, that we have at our farm and that we've had for a long time have been offset by community sponsorships. And then with SNAP and HIP coming into it, that's another way that we are able to offset that. And specifically with Food is Medicine, the relationship that we have, the contracts that we have with the ACO are what's helping us. And the relationship with Mass Health is what's helping a lot of our members pay for their shares. So there are ways built into our program, but I think ultimately we do try to talk about the value of local food as being high and talk about why. And so I think like it hasn't been that we will, undercut the value of what we're buying in or what we're producing, but rather to just talk about why the true cost of food isn't actually represented with the prices that we sell our food at anyway. But just, hop in.
Jessica?
Yeah, the only other thing I would say, I mean, it sounds like in the question that there's SNAP and double SNAP. So they might have something that's sort of similar to what we have here in Massachusetts with HIP. But to Meryl's point, I mean, I think, we're not looking to reduce the cost of the food to the farm because they need that money. And so the advantage, the opportunity here in Massachusetts, and I'm not sure what's available in Georgia, but getting, who benefits from that, the person becoming healthier, that the healthcare sector. So that's where we decided to like point our focus was how do we invite the healthcare sector to become a payer for food at the real cost of the food, and why do they do that? Because if we can show that there is a return on their investment with reducing the cost of care of that patient, even if they're paying the full price of the food, it's a win for them. And it's a win for the customer and it's a win for the food system. And so that's really where we're focused right now, is putting in the years of energy into working in partnership with healthcare to prove the efficacy of a robust investment in the local food system that ends up with healthier people and reduced cost of care of patients. And so that helps everybody. So that's where we're headed. So it's not a simple solution, but I wonder what the opportunities are in Georgia for you to invite your healthcare system to invest in the solution that they're looking for too.
I'll just add here, Meryl and Jessica both mentioned HIP, which is the Massachusetts Healthy Incentives Program, which is a SNAP incentives program that SNAP users can use at farmers markets that started with a Gus Nip grant a bunch of years ago. And Henrietta, I wanted to give you a chance to answer this as well. What do you do to help make sure that food grown by your farmers is accessible to everybody?
I completely agree with Meryl and Jessica. We don't want to reduce the price. However, like you all said, HIP is a really great tool for us. And another thing that we've looked at is our tiered CSA, where we get people not the same price, but they get fewer produce. So they are able to still access the CSA program, not at a full price with a full CSA, but half a box, but still paying, fair price value.
A question from David. Have any of you, and this is again for the farmers, grown for specific food as medicine buyers, allotting fields to a buyer, for example? So I guess it's really about contract growing. Have you gone into the season with a buyer saying to you, here's how much of X product we're going to need, and so you planted maybe differently than you would have otherwise?
That's an opportunity we'll be welcoming if it's out there. It goes to crop planning. No, we have not had that contract yet, but it sounds like something that will be exciting to look forward to. We do have the capacity to do that. I mean, for us right now, a lot of our farmers grow cultural crops like bok choy and yu choy, mustard, that is crops that people are sourcing from California and such, but knowing that we are here and we are able to produce that is a great, I think, like if we got a contract such as that, some farmers will be willing to commit to something like that.
Meryl, has this come up for you? Yeah.
Yeah, that's not something we actually have capacity for on our land, but I think like in committing to a certain number of shares, that's kind of how we are contract growing and guaranteed that we'll have that product. But I think it's an opportunity for other growers to get involved with us. So if we wanted to increase the number of shares that we were growing, I think we could probably like contract another grower to provide X more amount of shares. So I think there's opportunity there.
A question, wait.
Sorry, do you mind if I jump in, Winton?
Please, not at all.
I'm not a farmer, but like from the producer perspective, we have done some contracting with hospitals out in the Boston area. So it's not necessarily food as medicine in terms of like a prescription service specifically for an illness or a disease, but we do sell our frozen products to Boston Children's Hospital and Boston Medical Center. And that was really facilitated by our partnership with Healthcare Without Harm. They helped us to navigate the relationship with the procurement people at the hospitals and basically develop a plan for what they needed weekly and what they were going to buy locally that would replace a non-local ingredient. So right now we sell frozen carrots and frozen butternut squash to Boston Children's Hospital, and they take 2 cases of one and 4 cases of another weekly. And the idea is that contract is annual. Granted, there are cases where, supply won't allow us to fulfill that. So we've done a little bit of that and we'd like to do more.
Jessica, you reappeared. Did you have an answer as well?
Yeah, I just had an example, and they're not in the room here, but Hamid and Io of Aggregator in which is an urban farm in the Springfield area of Massachusetts, they were looking to double their CSA business. And so they were able to get connected into food as medicine indirectly by working with the Food Bank of Western Massachusetts, who works with C3 Accountable Care Organization. And part of what they do is fresh food boxes. And so through a contract that I was in development, so don't quote me, but between Aggregator and the Food Bank of Western Massachusetts, now Hamid and Io can confidently grow their CSA business through growing for this food box program. So it's an example of an indirect way to be involved as a farm with the food as medicine opportunity.
One more question specifically for Brian. And actually, Brian, I'd be interested in your thoughts on that question too. Would that be useful to you to be able to contract with a grower? Actually, I'll let you answer that first before I pose the question that's in the chat.
Yeah, absolutely.
That was easy.
Yeah, absolutely.
So someone who's interested in learning about the transition that community servings had when you switched from conventional buying to focusing on local farmers, what steps did you take to consider the change? Were there significant price increases, and how did you address that? And did you look at particular ingredients first?
Sure. So I'd say that it's always been part of community service mission, community serving's mission to support the community in this way. When I came on board 3.5 years ago, it was really a matter of sort of product and process improvement, which is just a normal standard kind of activity that you go through, and you do an evaluation of everything that you have on hand, and you look for better products. And so when you talk about purchasing food for the right reasons, that is an active decision, a conscious decision that you are making. So we're not saying, oh, I want to find a product that only fits this specific profile, or I want to find a product that fits a specific profile. And most of the time in the restaurant business, you're looking for something that is, driven by cost, or driven by cut, or driven by, branding opportunities. And for me, it was, what is going to be the most just item? What are the items that we're going to find that are going to fit this justice profile that we're seeking out? And so, in addition to saying, does it fit us financially and does it fit us nutritionally, we were also really prioritizing like who is growing it, where is it being grown, how are they growing it, and it's really kind of striking a balance between all of those different priorities to try to make the best decisions that you can. There are certainly still things that we buy that are commodity, like we cannot do 100% local all the time. And but we continuously do this product improvement analysis to look at what we're offering and seeing if there's something better on the market, seeing if there's something that we haven't seen before. And oftentimes we access a producer, or we connect with somebody just out of just pure chance. I was at a conference several years ago, and that's how I met our beef producer, and that they had an issue, and they said, hey, we have all this product that we not really understand. And again, it was a sales capacity issue, it was a logistics issue for them. What do you think we should do about this? And I said, well, I have absolutely an opportunity to access all of that product for you, and we just have to figure out how to connect on it. And so it was really just a discussion over a glass of wine after a lecture that led to that relationship that's been going on for a couple of years now. But actively, working with Katsarubis to help identify other people that would fit those profiles that we're looking for. That's just how we kind of go about it. But it's not a wholesale saying it's only got to be about cost, or it's only got to be about nutrition. It's really about balancing that profile. And one of the things that one of the other panelists said earlier, I apologize, I don't remember, was we're not paying, I think it was Jessica, we're not paying the true cost of food. And that is something that I take into consideration all of the time when we're purchasing things. Like, it's not just, I said it early on in the discussion, which was, there are hidden costs or deferred costs to what the product is. If we are asking local producers to compete against commodity producers and saying that those two items are the same thing, that they're exactly the same product and they're serving the exact same purpose, I think that's just not true. There are so many other things that happen that are positive when you're buying from somebody locally that you're supporting, and there's not these deferred costs of environmental impact, or abusive labor practices, or additional carbon footprint through transportation and storage and things like that. So finding a better way to really explain what the true cost of that product is, and then be okay paying what it's actually worth, as opposed to just pretending that what the market value for commodity is the true value of that product.
Yeah, I would add that we're not paying the true cost of food, but the most of the consumers aren't being paid the true value of their labor either. So it's an ongoing discussion to figure out how to balance those out. Recognizing that we're coming up on time, and we've started to lose quite a few people, I wanted to just throw it back open to all the panelists. Do you have anything that you had written in your notes that you really want to add before we wrap up? You got to say everything you wanted to say? I'm thoroughly exhausted from the last hour and a half. Thank you all. I've learned a lot. This has been a really great discussion. I hope that's true for the audience as well. And I hope that the panelists have also had a chance to learn from each other as well. Jessica, I'm going to turn it back over to you to take us home.
Yeah, thank you so much to our panelists. Thank you, Winton. And I think we answered most of the questions in the Q&A, but if not, please check out FIMA's website. I don't know if we can put that in the chat for everybody, Hannah or Jean. But someone had asked who was putting this on. So it is through the Food is Medicine Massachusetts Coalition. So check us out there, and you can get in touch with us for more information if we didn't get to your specific question. But thank you all so much. I hope this was inspiring. I hope it spurs some new activity and connectivity within our local food and farm system and our healthcare system. There's always more to say, so stay tuned. We'll be putting together some more forums in the future. But with that, we'll say thank you very much and enjoy the rest of your day and keep on persisting in the work. It's important. Thank you.
Thanks, everybody.
Thank
Thanks
you.
all.